Good morning and happy Friday. So today we are going to go through kind of a common topic that I definitely get asked about a lot. And this is about the different neuromodulators, also known as Botox and all of the other derivatives. I have my notes, of course, you love my notes. The Botox, Dysport, Xeomin, Jeuveau, and Daxxify. So I'm just going to go over what these neuromodulators do in general, and then also go over like my history of them, and then what I have coming up, what I'd like to try. And then I also would like to hear from all of you of what you've tried before, and then also, of course, if you have any questions. So just in general, Botox is like the term that is used, it's like Kleenex, when it's just the brand name, but Botox is just one of the neuromodulators. They all do the same thing. What it is, it's a neuromodulator. So it's a neuron that can change. So neuro meaning neuron, and then modulator meaning changing. So what happens is you inject the neuromodulator into the muscle. So any kind of muscle that you want to freeze, and then it just freezes that whole transaction that occurs. So that's kind of the easier way. I could go more scientific, but that's kind of the easier way. So it stops the neuron from stimulating that muscle that was injected. And so we use it, or not, I shouldn't say we, because I don't inject it, but it's being used to just get rid of a certain kind of lines. So we have static lines and dynamic lines. So dynamic lines are like the lines that move when you talk. So sometimes you might not be able to see those dynamic lines, but maybe if a lot of people have noticed that after being on Zoom calls after 2020, they notice that they have a lot more lines that they didn't realize because they're not usually watching themselves on video. So dynamic lines are like any kind of things that move, and then eventually they become static lines. So like if you do this enough, you're going to get the wrinkles up here. So over time, those dynamic lines become static lines. So they talk about preventative Botox. That would be maybe injecting into those dynamic lines before they have become static wrinkles. And most people, and I think like me, I think I first started getting Botox around age 30, which I probably could have been one of those people that got it like when I was in college, because I remember in college and med school, I would always look confused in class, and the professor would always be like, "And what, Reed, why are you so confused?" So I probably could have had it a lot longer, but I never was really like, I didn't even know about that. I think Botox has been around for cosmetic use about 20 years, I believe. So I couldn't have even used it when I was in college. But so I started getting it around age 30, and got it mainly because I do have hooded eyes. I have lots of videos on, what I've done for the hooded eyes. And I did notice that it helped tremendously with that. So, definitely in the 11s, I always used to get it because, I have that expression of confusion a lot. And then I got it just to raise my eyebrows a little bit. So that's personally why I got it. So I got it more when it was in like the dynamic stage and never really got to like the static wrinkle stage. But that's usually what you do. And then in terms of, I'm just looking again at my notes, in terms of like how many units, usually in the forehead, most people get like 10 to 25 units. In the brows, right around the brows, it's like 10 to 25 units. And then in the crow's feet, it's 5 to 15 per side. So that's typical of what you would expect. And in the United States, per unit, it could range anywhere from $10 to $20. And then the main side effects are mainly bruising at the injection site. Some people say that they have headaches. Some people say that the headaches get better, but those are the main side effects. It's probably the most used cosmetic procedure, and it's also really the safest, even though, yes, it is a toxin, but it is really the safest. So let me go over, and when I say I got Botox when I was 30, I've always gotten just brand name Botox, only because that was the only one that was out when I was 30. And then, I did it off and on, and then I started doing it a little bit more regularly as I got older and continued to do it. And then just recently, well, I guess not recently, like what, July. So like about 7 months ago or so, I did do Xeomin. And the only reason I did Xeomin is because I went back to the doctor that did my blepharoplasty, and then that's what he was using. But I did like it. I don't think I noticed any difference. I mean, maybe it did last longer on me, but other than that, I didn't really notice any differences. I liked it just as much as I've liked Botox. So basically, and again, I'm going to look down at my notes. Botox is, I'm going to just go over like why you would get one over the other of the different ones. So Botox, it has 4 large proteins around the toxin. And so those 4 large proteins, whenever the body senses anything that's large and abnormal, it can make antibodies against it. So when you hear about like Botox resistance, sometimes people who have been getting Botox a long time, their body can develop resistance to it. And that's because it has all of those big proteins surrounding the toxin. Then there's Dysport, and Dysport is a whole different protein that surrounds the toxin. Some people say that it kicks in quicker. And then the saying is that Dysport diffuses. So Botox really goes right exactly. You can be very precise with it. I mean, as you can see, like these are very prominent with me. You can actually see the muscles are pretty pronounced. So like Botox would be something that you would do right at that muscle. But if you want something that's more diffuse and just like getting rid of wrinkles, then you would do something like Dysport. So Xeomin does not have any proteins surrounding the neurotoxin. So it's thought to be the one that is like the most pure. And if people have had resistance to Botox in the past, then Xeomin might be recommended. Or if you have a history of just sensitivity or lots of allergies to things, then you might want to get something like Xeomin. I didn't choose it for that reason, but again, I remember after I had my episode of my autoimmune urticaria, I was afraid to get Botox. And I was like, just do it. You're never going to know. Again, as I said in previous videos, I'll never do filler again because that could have been one of the reasons I got the autoimmune urticaria. But Botox, at least, like, it does go away. All of these go away within 3 to 4 months. All these neurotoxins do. They don't stay in the system like something like filler. So I didn't get Xeomin because of my history of skin sensitivity or the urticaria, but it was an added bonus. And then there's Jeuveau. Jeuveau is newer, and I guess from what I've heard, the marketing is more towards younger people, more of that like preventative Botox, and being used, like they even have like they're thinking of doing like some kind of like program. What is it, like subscribe and save, where like you get it every 3 months, you sign up to do it every 3 months or so. And so that's to do it preventatively. There's lots of pros and cons to that. That could be a whole video in itself. But so Jeuveau, they actually had a lawsuit that was Botox sued Jeuveau because the proteins are so similar. So that just tells you one thing. And then again, it's very targeted. And then the onset possibly could be quicker. Again, you don't really know. And then Daxxify is newer, and what Daxxify has is it has a positive charge. Daxxify itself has a positive charge, and then the neuron has a negative charge. So the two attract, and they tend to really stick to each other. So Daxxify is thought to last longer. And from what I've heard, it does last longer. So people think, then I'm going to be able to save money, but Daxxify is a little bit more expensive. So Botox, Dysport, and Xeomin, those last about 3 to 4 months. Again, it depends on your metabolism. I find that I metabolize all the medications pretty quickly. At one point, I thought that the Xeomin had worn off even quicker than the Botox, but then after just watching my facial movements, like when I see patients on telemedicine, I think that it might have lasted a little bit longer, but I am getting it in 2 days. So I'm going to obviously do like some shorts on that. And we'll kind of see, this second time around, I'll be able to, determine a little bit better. And Jeuveau, I'm not really sure. I'm assuming that Jeuveau is similar to Botox. And then Daxxify supposedly is supposed to be like 6 to 9 months. And that was like basically the thing that I wanted to say. So again, as I said, some people just like Botox because it's the basic one that they're used to. If you have someone, or if you're someone, I'm used to talking like a provider, but if you're someone who is thinking about something like with resistance, or you have a lot of allergies, you might want to go with Xeomin. And then Daxxify, if you want something that will last longer. And then also Daxxify is not made with any human or animal byproducts. So if you're vegan, Daxxify might be something that you would want to use. Let's see. That was about all that I wanted. Oh, and then another thing to remember is they do, all of them take, I mean, even though supposedly Dysport acts a little bit quicker and possibly Jeuveau acts a little bit quicker, but yeah, again, I'm looking at my notes. Yeah, Dysport and Jeuveau are the two that act a little bit quicker, but most of them take about 10 days to see the full effect. So when I do my shorts, I'm not sure if I'm gonna do the shorts before this video comes up or after, but when I do them, I'm just gonna show you the difference of everything. And then mainly what I do is when I get Botox, again, I try to, well, I don't do it, but the provider really focuses on this area because, I tend to have such a strong confused state. And then when I smile, a lot of times my eyes kind of turn down. So what they try to do is just like, freeze these muscles here because these are the ones that pull the eyes down, and then freeze these here, and then just focus on more lifting of the eyebrows. Nothing crazy, but very, very slight. But it's more that I don't have those pulling muscles that are pulling it down when I talk and when I smile. And I can always like move my face afterwards. The main thing I can't do is like do this, which obviously I can do right now, but that's the main thing that I notice. But again, I think when I do the shorts, it will be interesting. So hopefully this video helped. I certainly learned a lot when I was doing research for the video because I was always confused at what the differences were. So, I watched a few videos, read a few things, and then kind of broke it down here. So hopefully that helps. Let me know if you have any questions that hopefully I can answer, or we can, as always, share things. And thanks so much for watching and commenting. I love when people say that they're so glad that they found my channel, because I'm so glad that you found my channel. Because that's the goal, is to have everyone just share things and share their experiences. So thanks so much. And I will see you next week, and have a great day.